Sure. So at-home tests, there's two types. One is you collect the sample at home, and then you send that sample into a laboratory that then processes it and then reports that through the electronic reporting system. The other is the test that you collect at home, but then you result it at home. So you're processing the test there. Those at-home tests are not required to be reported to the health department. So there are people who tested positive that we don't know about. But they have the results. They know what their status is, so they can make the best, with that knowledge, make the best decisions for themselves. So there's a couple things about that. One is was the potential for it not being processed maybe correctly. Also, what they suggest in the guidance from the state is those tests can be used if we had, say, at a cluster, so 5 or more cases at a location where we needed to supplement those numbers. So we could use it in that regard. But knowing the amount of tests that we have across the board that are turning positive right now, our numbers are so big that those extra test numbers probably would make a big dent in the big overall epidemiological number pictures. But I think the best thing is if people have those tests and they do find out they're positive, please take their recommendations and stay home, isolate for 5 days. Now that with new changes in the guidance, and also once your symptoms have gotten better, you've been fever-free for 24 hours, then continue to wear your mask for 5 days after that.
Regarding the guidance question, right now, currently, North Carolina Department of Health and Human Services has not updated the child care or the school toolkit. So as soon as they do, we will definitely be in touch with the school system, the local schools and the child care providers. And regarding the testing, I do believe the school system is on board to begin doing some of the testing in the coming semester, the coming start of school in January.
Richard, that's a smart question. That's what everybody's, how do we celebrate, but do it smartly? So stay in your bubble. If you know your people that have been vaccinated and boosted, you can have great confidence in knowing that the ability to contract COVID is probably relatively very small. So just be smart, stay, I'm going to reiterate what been said at the federal level. Keep your party small, but if you're going to be out there doing wild and crazy things, probably not the best idea right now this year.